Hello students, welcome to United Regional Healthcare System. My name is Tony Richardson and I serve in the education team here at United Regional. I will be your liaison, your primary point of contact between yourself, your school, our organization. So please do not ever hesitate to reach out to me if there's anything I can do to serve you or to help your experience here be a successful one. We have worked very diligently and over many years to create and to cultivate a culture of excellence in our organization. And our expectation is that while you're serving with us, you will assimilate into our culture. Our expectation is that you will reflect what is important to our organization, that you will endeavor to help us to achieve our passion to provide excellence in healthcare for the communities we serve. So, with our passion and our purpose in mind, please pay careful attention to the following video. Now, in this video, we're going to briefly discuss expectations, what our staff will expect of and from you, and what you should expect from us. We're going to discuss standards of behavior, appearance policy, safety, security, parking, and some service expectations. And please know, the motivation behind these programs and these policies is primarily patients first. When it comes to healthcare, it is not about me as a caregiver. It's not about how hard my job is or what's happening in my personal life. It's not about how hard I've worked or how smart I am, right? It's all about our patients, always. How they are, how they feel, the quality of the care that they are receiving. Patients first. It's not about me. With that, let's briefly discuss some expectations. We are a professional organization. As you are here, you are a representative of United Regional. You'll be expected to comport yourself with the utmost in courtesy and respect. We talk to and about each other and our patients with respect and dignity. We live what can be called the grandma rule. We must strive to treat others as they would treat the person who means the most to us in our lives, right? That person who we love and cherish the most, and that's, for a lot of people, that's grandma. And so how would you want your grandma to be treated if she were a patient at United Regional, or if she worked here? Each one of your coworkers and our patients is that person for someone. So regardless of where the other person may be from, how they may be dressed, or how they may speak or vote, or the lifestyle they may happen to live, or how they may smell or even behave, you are expected to show the utmost in care and caring toward them. Sir or ma'am are always well received. Mr. or Ms. are also acceptable. Please do not assign pet names to perfect strangers. You know what I mean? You know what I'm talking about. If you've been to almost any restaurant in this town, hey there, sweetheart, baby, sugar, darling, sweet cheeks. Pet names are just unprofessional, and they're simply not appreciated by most people. So please, if you're in the habit of assigning pet names to perfect strangers, please get out of that habit while serving at United Regional. Engagement is the key. When considering the following service expectations, please keep in mind that the goal is engagement. Engagement with the human beings around you. Discipline your habits. Seek to be, not to be, that is, distracted while serving in and around our organization. The following are policies. These are foundational expectations for anyone and everyone wearing a United Regional badge. This is what you should expect from us, from staff, from volunteers, and this, of course, is what we will in turn expect from you. Our 10-5 policy is kind of simple. It's a little cheesy, frankly, but it's absolutely essential. Regardless of where you happen to be or where you happen to be going, When you encounter another human being in or around our facility, and they are within 10 feet of you, the expectation is that you're going to make eye contact and give them a friendly smile. This communicates a warm, open, welcome attitude and can make a huge difference in the lives of those you encounter. And so if they're within 5 feet of you, then of course make eye contact, smile, and then offer a friendly greeting. Hello, good morning, good afternoon. If you're walking in or around our facility, engaging with those around you, and you notice someone that is lost, they don't appear to know how to get where they need to go, or if they ask you for their directions, then of course you are expected to approach that person. Ask them if you can help them find where they need to go. Then, rather than giving directions, the expectation is you're going to take them there. If you don't know where there is, then of course you must find someone else who is wearing a United Regional badge and ask them to help you both find where that place is. And then you should go with them so that you may know where that place is in the future. Regarding Aid It, Aid It is a tool that we use here. It's a part of our culture. It's how we introduce ourselves to our guests. In one of the following videos, our Director of Patient Experience, the excellent Mr. Ryan Graves, will explain in a little more detail how to utilize that tool, how to best approach our patients and guests, and to provide that excellence in healthcare. And so I'm not going to talk about it now. Just know that it is an expectation. That's a tool that you will be using while serving at United Regional. Lastly, our phone policy. Please know that our phone policy is very restrictive, intentionally so, and we do enforce our policies. If you have your cell phone with you while you're serving at United Regional, our patients and our guests don't need to know it. This means that you must never pull out your cell phone and use it in view of a patient or guest. And going further, you must not pull out your cell phone and use it in an area where there may potentially be guests or patients. Cell phone free zones, of course, you've seen in the previous video. They include areas like busy hallways, elevators, guest waiting areas, patient rooms, and even the cafeteria. You will be expected to engage with the human beings in the cafeteria as well. That may surprise you. If you need to use your cell phone during your break, then by all means, you can go down to the cafeteria. We encourage you to get yourself something to eat, but then take that food to a break room somewhere away from patients and guests. And there you can completely ignore all of your coworkers and fellow students the entirety of your break if you so choose, but definitely not in the cafeteria. If you do choose to eat in the cafeteria, and you're welcome to do that as well, but we would ask that you not use your cell phone while you're there. Engage with your fellow students, with the guests there, with the staff of United Regional, but do not use your cell phone in the cafeteria, please. With regard to appearance, okay, as you will hear from Mr. Ryan Graves, we only get one chance to make that super important first impression with our patients and guests. And so we need to take advantage of every opportunity to make a positive impression on our patients and guests. And so remember, when your patient believes that you care for them, that they can trust you, they do better clinically. And that's the bottom line. That's really the goal. And so also, by the way, it doesn't hurt you to know that if your patient believes that you care for them and that they can trust you, your job gets exponentially easier. Patients become more patient, more forgiving. They feel more comfortable asking questions and are more likely to listen when you give instructions or advice. And so to that end, United Regional has a somewhat conservative appearance policy. Remember, it's not about you, it's about our patients. When it comes to scrubs, your scrubs, of course, you'll wear your school scrubs, and that is absolutely fine. But they will need to be clean. That is an expectation that we have, and of course your school has as well. That is clean. That means not stained or soiled in any way, not smelling dirty, like body odor or like yesterday's patients. With that, though, with regard to smell, please know that United Regional is a fragrance-free facility. And that, of course, means that as a direct caregiver, you will be expected to not ever wear perfume or cologne, or that, that strong smelling Bath and Body Works body spray or hand lotion. We have patients and guests here who have conditions or who are on medications that make them especially sensitive to smells. Thus, your nice smelling cologne could potentially trigger a migraine headache or nausea and vomiting or an asthma attack. And that, of course, is definitely not what we're striving to do for our patients. And so the expectation is you'll not be wearing those things. Now, as far as fit, we expect that your scrubs are going to fit you. That is not too tight, not too loose, right? If your patients can tell what you're wearing underneath your scrubs, they may be a little too tight, right? And that's definitely not a professional appearance. On the flip side, if your scrubs are too loose, then they have a potential to snag and or drag through body fluids, which is both a safety hazard and an infection control issue. And so it also, if every time you bend over to pick something up or to do some work and some part of your body is exposed, then that, of course, is not what we're going for either. That's definitely not a professional appearance. And so please ensure that your scrubs fit. Regarding tattoos, our policy is very simple. If you have a tattoo, our patients, our guests, do not need to see it, not ever, at any time, or for any reason. To that end, we require that your tattoos be fully covered at all times by clothing. Fully covered, meaning not partially covered, fully covered at all times. And of course means that, if my sleeve covers my tattoo now, but then when I start working, it rides up and now my tattoo is exposed. That is not fully covered at all times. And so we need to wear clothing that will completely cover, fully cover at all times, all tattoos, regardless of what my movement, my duties happen to be. And by clothing, of course, what I mean here is if you have a tattoo on your neck, the expectation is you're going to wear a turtleneck, not a bandage. If you have a bandage on your body, we're a hospital. We assume you have an open wound. If you have an open wound, that's an infection control issue. We're not going to let you serve while you have an open wound for your protection as well as our patients' protection. I believe that most of your schools have a no earrings policy, and so please follow whatever policy is more restrictive. I would never encourage you to disregard your school's policy. However, we do expect that you're going to follow our policies as a guest of United Regional. So please seek not to violate our policy. So regarding earrings, our policy is that regardless of gender or non-gender, you're only authorized 2 studs per earlobe. That means no hoops or dangling earrings. That also means no earring or rings in the tongue, lip, nose, cheek, eyebrow, those areas. Also, that would mean that please do not wear any industrial piercings in your ear. Listen, if I can't see it, it is none of my business. What I'm talking about are things that our patients and guests can see. We would ask that only 2 studs per earlobe for any direct caregiver, and that of course includes you. Lastly, regarding hair color, United Regional's policy is that your hair must have a natural appearance, natural in color and in pattern. Your hair does not have to be your natural hair color, but it must appear natural. Natural, that is, in human beings, not in birds or fish or butterflies or animals, but a natural professional appearance while you're serving here, please. So that's our regarding safety and security, and we're almost finished, folks. Hang in there with me. We're almost there. So we've discussed appearance and behavior. Let's talk briefly about security, safety. Very important to staff, to our patients, to our guests, and of course to you, to our students. So please let me reassure you that United Regional has a first-rate security team. There are 0 rent-a-cops serving here. You will find no Paul Blarts walking the halls of United Regional. Our security team is as well trained and as well equipped as any police officer in this city. They are professional and they are proactive. You will find them posted at all of our busy entrances. They are walking our halls. They are patrolling our campuses on foot and in vehicles in our parking lots. They are absolutely dedicated to keeping everyone, that's students, staff, contractors, patients, guests, everyone safe and secure at all times. You will find, by the way, on your ID badge when it's issued to you that not only their desk phone number is listed there, but also their radio number. So they are within reach very quickly, immediately, if you see something unsafe. And so with that, if you see anything or anyone unsafe while on our campus, either in our parking lots or walking our hallways, do not hesitate to call our security team. They will react swiftly to ensure safety and security. Speaking of the badge, by the way, while you're serving here with us, you will be expected to always have your United Regional ID badge. Folks, if you forget your ID badge at home, go home and get it. You may not ever serve without your badge. And please know that our awesome folks in Human Resources are not going to issue you a backup badge. Now, if you do lose your badge, do not hesitate to go to Human Resources and they will issue you a new badge for a small nominal fee. But also please be sure to alert security so they can discontinue your access for your old badge, because whoever finds that badge now has access to whatever you had access to. And of course, that's a security safety issue. We want to make sure that only those who need access have access. So please, if you lose your badge, alert security immediately. Now, your badge should be worn above the waist in a clearly visible location. That is, of course, not under long hair or under a lab coat or a jacket or a vest. So mounted above the waist, clearly visible. Now let's talk briefly here about, as a student serving at United Regional, you will be expected to park in one of our student parking lots, shown in light blue on your attached parking map. The main student parking lot is on Brook and 8th Street, which is a good distance from United Regional. I understand that, somewhere near Burt Burnett, but it's there just behind the new Frank and Joe's Coffee House. By the way, if that lot is full, you may also use the overflow student lots across from Brook Street. You will be required to complete a parking policy acknowledgement to register that is your vehicle with our security department. Once you have done so, you will be issued an orange parking placard to hang on your rearview mirror of whatever vehicle you happen to be parking in our parking lot, and that'll indicate to our security staff that vehicle belongs to you. And of course, we'll have your phone number listed in case something happens to your vehicle. We'll be able to call you and let you know that immediately. Please be sure to return, by the way, your parking placard along with your United Regional ID badge to us, to Human Resources, or to your instructor upon completion of your medical program or upon graduation, or when, God forbid, you have to drop out of the program for a time. We'll need that badge and that parking placard back. Please do not ever park in our guest parking lots. Those are the ones shown in yellow on your attached parking map. Our security team is not allowed to boot your car as they do our staff if you park in the wrong spot. So therefore, they'll be forced to have your vehicle towed if you park in a parking lot assigned for our guests. So please refrain from parking there. Please do not park in those yellow parking lots. Don't put our security staff in that position. They don't want to have your car towed. If you are a staff member, by the way, of United Regional, you serve here in a different capacity and you're a student, remember, you are only allowed to use our staff parking lots when you're here working as a staff member on the clock. If you're here in a student status or capacity, you will be expected to park in designated student parking lots. Please be sure to lock your vehicle, as we often find transient people wandering around our parking lots. And by the way, again, if you see someone there who does not appear like they belong there, please contact security. You have their phone number on your badge. There's also an emergency little pole there in the parking lot that you can push a button, and there's a camera there, and you can talk directly to someone in the security office. They'll be able to see you and send someone to respond if there's something fishy happening in the parking lot. And lastly, please refrain from parking in any of the parking lots belonging to nearby businesses. We are a large organization and could easily overwhelm our neighbors, and we don't want to do that. And so be very diligent. Only park in student parking while you're here. Also, many of the businesses, by the way, will not hesitate to have your car towed if you are not a guest of their business. And so, for instance, Promise Hospital, Dr. Patel's office, Texoma Medical Center, those businesses, they need parking for their patients and their guests and staff. And so please don't park there unless you happen to be doing business at their business. And so again, primary parking is in green. I have highlighted there, it's the blue parking lot on your map, and then the secondary is in yellow. I have highlighted there if there's an overflow. So that's our part. Now back to security. Regarding weapons, if you are a concealed carry licensee, you are authorized to carry your weapon to our parking lot and leave it locked inside of your vehicle in our parking lot. Per state law, of course, you're allowed to do that. You are not, however, authorized to carry your firearm or any other weapon into our facility at any time or for any reason. Again, we have an armed security force who are always, in a forward-leaning posture, ready to respond to any threat. And so you need not carry your weapon into our facility. Your badge will list all of our security codes that you may hear announced on our PA system. Please follow the direction of your supervisor during any emergency. Just follow what they direct, and you will be cared for and kept safe. During a code silver, though, specifically, which is an active shooter, we follow the run, hide, fight guideline that I'm sure you've heard those. Unfortunately, in the culture that we live in, that's everyone has to discuss those things. And so if there is an active shooter, if you're able to flee away from the shooter or shooters, then do so. After leaving the building, by the way, please be sure that you come out with your hands raised and free from any type of weapon, so the police and our security team can quickly identify you as a friendly and not as a threat, and just follow their directions so they can make sure that you're clear. But if you're not able to flee, you're in the building and you're not able to flee, of course, or if while you're fleeing you come across a shooter or shooters, then by all means hide. Try to hide, get to a room, lock the door, cover the door window, barricade the door, turn off the lights, place something between yourself and the door, silence your cell phone. Of course, call 911, alert them, call our security force, let them know where you are and where the shooter is and what kind of weapons you may have seen, whether it was a shotgun, a rifle, a pistol, that sort of thing. And lastly, upon first becoming aware of the presence of an active shooter, attempt to locate and secure a weapon. Something sharp, something heavy, like a letter opener, a screwdriver, a chair, a fire extinguisher, something that you can use to protect yourself. Because if you discover that you cannot hide, or if while you're seeking to find a hiding place or to run, flee the facility, you happen upon a shooter, you must be prepared to defend yourself and others against this threat. And so run, hide, and fight. Be always prepared to do any of those things at any time in the event of a code silver and active shooter. Folks, I appreciate your time and attention. Please be sure to watch all of the following videos in their entirety, as you will be held accountable for adhering to our programs and policies while serving at United Regional. Our staff and our patients and your safety, security is important to us. And so please understand what those policies are. Never hesitate to reach out to me if you have questions or concerns. And once again, welcome to United Regional. We're excited to have you learning with us and hope that you have an excellent semester and a long rewarding career in medicine. Have a great day.